our treatment modality we use at the lymphedema clinic is complete decongestive therapy. So to us, that's another part of doing it really well, is if you're going to put that word complete in there, you shouldn't be skipping anything. You should be doing it all. You should be educating on it all and handing off to your patient of here's the tools you need to manage this long term. So complete decongestive therapy was developed by Dr. Emil Vader and his wife in, I believe, France, but in Europe around 1932. So it's not brand new. It's been around, coming up on 90 years now. It's bigger in Germany and Europe than it is here. We're kind of behind. So complete decongestive therapy includes compression of some type. Usually in the intense phase, it's compression bandaging, it's skin care, wound care if that's part of your skin care, remedial exercises, and self-manual lymph drainage or therapist applied during the intense phase, actually. Some people will call that a massage. Some of my colleagues cringe at that because they don't want you to think of a deep tissue massage. It's really just superficial at the level of manipulating the skin. So you're getting the skin moving. During the massage part or the manual lymph drainage part, there is a little bit of a fluid moving effect. You will see tight skin begin to have wrinkles or space in it. So that's really neat to see. The bigger impact, though, is when you're doing that, you're stimulating the nervous system to speed up the contractions of how often it'll pump fluid. At rest, each little section of your lymphatic system contracts about once every 6 to 10 seconds. Pretty slow, pretty in the background working, but not doing a ton. But it will speed up to once per second to once every 6 seconds, which is 6 to 10 times faster. And manipulating it with the massage will get you that effect, and your body will maintain that for most people around 24 hours. So that's the bigger impact. Is sure, I apply this technique for 20 minutes, but I'm getting 23 hours and 40 more minutes of benefit out of it. And to compound that progress, if you're in compression, it's going to work better and faster. It's going to be able to absorb better and keep going. So those 4 steps in the intense phase: compression bandaging, skin care, wound care, the remedial exercises, and the manual lymph drainage kind of all come together to help you get reduced. And then once you're reduced, you switch to the maintenance phase, it's usually called, which is really the patient taking over those responsibilities. So now, instead of compression bandaging from a therapist, we're going to do a compression stocking or a Velcro garment that's going to help keep that swelling from coming back. We're going to teach the patients how to do either brushing or sweeping or self-manual lymph drainage to try to maintain all that progress and keep their system working faster. And we're going to hand over the responsibility of skin care, of putting on lotion or whatever. Usually not wound care at the maintenance phase. Usually we heal people before we switch to that. But if there's still something to take care of there, we want to make sure that our clients know what they're looking at and when they need to give us a call or their doctor a call or anything like that. And that's kind of it, I think. In the maintenance phase, you're just managing your own manual lymph drainage or self-massage, compression bandages, compression stockings or garments, and your own skincare. And then you're going to continue those remedial exercises we talked about. They're not hard, they're not strenuous. It's just kind of going through your range of motion and holding it in range. So it's a isometric flex for 3 seconds and then relax for 3. Sometimes people, I don't want to scare anyone off saying we do exercise as part of our program, because it's not strenuous, it's not taxing or fatiguing.